you're going to hear from the doctors themselves.
They are put under the pressure of working relentlessly.
People of your kind, your profession getting beaten up. It's a very scary thing.
And they just give us that threatening look, or they give us that comments that's quite scary.
India is going to suffer in the coming years. Assam, Delhi, Mumbai. I won't waste your time mentioning the things that you have already watched, but here are 5 things that you seriously need to know. Number 1, there are so many cases of doctors being abused, threatened and attacked that are not being recorded. Number 2, the medical infrastructure is going to be worse in the coming years.
The pressure and the sort of toll that it is taking on the minds and bodies of doctors and healthcare workers, mistakes do happen.
Not everyone will agree for that. So people might get scared and not enter this profession by itself.
Every day in social media, me and my friends see a lot of violence against the doctors.
Parents are scared that their children might get beaten up for things they have not done. So this will lead to less number of people entering into healthcare professions, which might lead in already the India is facing scarcity of healthcare infrastructures and officials.
You don't beat up a teacher when a student fails despite the teacher's best efforts. Then why do we treat doctors as if they have to save every patient brought to them?
It's not that we would not deliberately deny healthcare to the people in need. If you don't have the facilities, there's no point in accepting the patient here.
At the same time, it is true that not all doctors are good at what they do. India has repeated itself from religion to politics and now to profession, that when one person does a mistake, the whole community is to be blamed. The blame game has become so big that thousands of doctors are already feeling to shift abroad, quitting India. Even students who are into medical field are now afraid of becoming doctors, and all of these could lead to a huge problem in the medical infrastructure of the country. Number 3, doctors give treatments, not the cure. Doctors are humans, not God.
We have to accept that as humans we all make mistakes. Every profession people make mistakes. Even a good doctor can make mistakes when they are put under the pressure of working relentlessly.
It's a fact, when a patient arrives, they come pleading for help to save them. The doctors first of all take the risk, taking the responsibility of the patient. If he is saved, doctors are being kept up, and if he is not able to save, then all the anger is taken over him, thinking he did it on purpose. If you think in a neutral mind, a doctor already has a good income. Why would he try to spoil his 30 years of hard work and the respect he earned by doing such a thing?
Nobody starts his day thinking that I have to cause harm to someone.
Now it's not only the doctors. Misinformation has spread so much that even interns are getting threats for no reason. And this will only sow seeds of mistrust and misgivings that will only do more damage to the public healthcare of India. Number 4, attacks on doctors have become so common that they are no longer news.
I personally don't feel safe here.
There were many drugs which were introduced which even the health authorities are saying that they are no more effective, or they need not be tried in COVID. So there is a lot of uncertainty about what works with this virus and what are the treatment guidelines. They keep changing frequently. All this leads to a lot of confusion in the public, and add to that misinformation and which spreads in social media and WhatsApp and all that. It can create a lot of mistrust towards doctors.
It is very disturbing. You have been working for 24 hours, 12 hours for the people, for the patients, for the sake of patient, and you come home, take rest and open your social media and you see people of your kind are getting beaten up. So it's a very scary thing.
Doctors are saving us from COVID, but who will save them from ourselves? With so much fear, how can one work? The entire healthcare sector will collapse if it continues in the same way. We talk about giving international level quality care in public hospitals, so why not international safety policies? The government should make strict laws providing security for doctors before any person tries to take the law in their own hands. Number 5, doctors are lacking communications, which leads to lack of connection between the patient and the doctor.
So the communication gap could be a reason as well.
It's not humanly possible for them to really take care of a large number of patients, right? And when our hospitals or our clinics are crowded with patients, when there is a surge of cases and everybody comes into the hospital for help.
The patient doesn't know what's going on the other side and fails to get a proper explanation from doctors. And this leads to confusion and misunderstanding from the patient party, leading to anguish. Don't get me wrong, I'm not here to tell who's right and who's wrong. I'm here only to convey what consequences we could possibly face with our actions. And I hope the responsibles try and do their best, may it be the role of a patient, a doctor, or the government, to understand each other and try to overcome this pandemic. That's it for today. Until next time.